Hello, my name is Dr. Rachna Mehta. I'm a women's health and orthopedic physical therapy working at Hamilton Physical Therapy in Hamilton, New Jersey. So today we are here to talk about the treatment for urinary incontinence. And I want to show you this model that we will use for patient education and also show you the different treatment modalities and things that we use to treat incontinence. So based on your doctor's diagnosis and our comprehensive physical therapy examination, we would determine what type of incontinence you have. And if you look at this model of the pelvis here, this is the pelvic bone structures. These are the muscles, and so these are the pelvic floor muscles that we would look at. Now, the pelvic floor has three different types of muscle groups. The first muscle group is the outermost pelvic floor, that's right here. That's the introitus, and that's the anal sphincter. Now, when we do a physical therapy examination of the patient, we would be doing an external examination to look at all the structures externally, and then internally we would be doing an internal examination to look at the pelvic floor muscles here. Now, the pelvic floor muscles are composed of two different types of muscle fibers. 70% of these muscles are slow twitch, meaning they contract long and they relax long. And then 30% of these muscles are fast twitch, meaning that they are contracting very fast. So in order to train the pelvic floor muscles, we use biofeedback, and this is the unit that we use at our clinic. It's an MR25 unit. And we connect this to a laptop, and there's a software program that we can look at and see how the pelvic floor muscles are contracting. We train the patients to do their Kegel exercises on this unit, and when they look at the laptop screen, they're able to see how their muscles are contracting. So they could do slow contractions, in which we do different application protocols that are inbuilt into the software computer system. We use long contracts and relaxation in that. We do 10-second holds and 10-second relax, and that goes on for a few minutes and 20 or 30 repetitions. And then we do fast ones, which are 2-second work and 4-second relax. So we try these different types of protocols to strengthen the pelvic floor in both ways. Now, in addition to that, we can also give the patients homework to do, and they can use this E-stim unit at home to strengthen their pelvic floor muscles. In addition to that, we also have this incontinence video that we use to educate the patients on the different types of incontinence and to work on behavioral modifications that they can use at home in order to see what they're doing at home. We also teach them home exercise programs. We teach them about how to monitor themselves during the day and how to encounter accidents when they happen and what they can do about those accidents. And when the patients have progressed about 2, 3, or 4 weeks down the road, then we can also do vaginal weights. And these are weighted cones that they can use internally, and they do different types of exercises with that. So the first step for the exercises is that they would do the exercises lying down, and as they progress, then we progress them to sitting, standing, and functional positions. In functional positions, we would try to determine where their accidents are happening during the day. So say a patient tells us that their accidents are happening when they squat, then we would do Kegel exercises in squatting, and they can see their contractions on the screen. And if a patient says that they have urgent incontinence, and when they put a key in the door, that's when their accident happens and they really feel that urgency, then we would try behavioral modifications and tell them that they should be relaxing more. Some of the techniques that we use are we tell them to count backwards, and that helps them to pass over that urgency feeling, and that helps with that incontinence. And then beyond that, we would follow up with them with bladder diaries, where they keep a record of their bladder function and they monitor themselves. So that concludes the treatment for urinary incontinence. Thank you.